Hey everybody, Dr. Rob here. How you doing today? I already got a text. We did a little trial run. My friends are teasing about the hair. So we're ready to go. It's Tuesday. I hope you're having a great day. So much information. You definitely want to watch this. You want to share this. Love to see those shares. Please make a comment, like it. This is really going to motivate you to really understand the health and the health pandemic. I mean, what else is there really to talk about? We have Senate hearings. We've got people saying this and people saying that. And, you know, the number one thing that everybody asks me is, who do you go to? Who do you trust? And what's the deal? So I'm trying to shed light every day on what makes sense. And it's data science driven. It's not my opinion. It's data and science driven without question. So once again, feel free to like, comment, share it, follow the Instagram. As you all know, we have affiliates. They help us out greatly. Every day, we've got Dr. Mike Warren and Powell of Chiropractic in Medford, Oregon. I know Mike's on right now. We were just talking before. We've got our good friends from 8 Weeks to Wellness, Dane Donahue and Veronica Holt. And everybody else who's out there. We've got a lot of good responses, a lot of questions. And we got some special guests coming on this week that we're going to share.
Say hi to Siri.
Hey Siri, how are you? Big shout out. Let me know that you're there. I'm happy to do some shout outs. So let's get going. So a new concept. You haven't heard it before. Immunonutrition. So obviously it's nutrition to help your immune system. There's been some more recent articles talking about immunonutrition. So let's get a little definition. Better use of immunonutrition could benefit vulnerable groups during a pandemic. So it's been coined for a time frame like this. In addition, the importance of nutrition for optimum immune function really pointed especially over 65 because that age group has really been affected adversely. Just being a little older or having your Medicare card with your AAP card leads you down a path of that comorbidity because the older we get, as we all know, our immune system decreases in its effectiveness, and we call that immunosenescence. And we want to keep our immune system robust, helping us, teamed with a boatload of good quality cells. So having said all that, there are a few nutrients that come to mind that the literature just says this is the way to go without question. They're basic, but they're powerful, they're potent, and they're going to help you with immune function. Number one, what a shock. Linus Pauling was right. Vitamin C. So in 2017, there was a study done. There was 2 controlled trials, and it found that vitamin C, and we can get all these citations, prevented pneumonia. So great choice, vitamin C. Big proponent of 1,000 milligrams daily. In this instance, you may want to take 1,000 milligrams every 4 hours. So you may want to go to 2 to 4 grams. 1,000 milligrams equals 1 gram. Another study really spoke to the idea of 2 controlled trials where had a treatment benefit for pneumonia. So not only does it help decrease your incidence of pneumonia is usually coupled, the lungs are coupled very high susceptibility within this COVID-19 health pandemic. And I never realized many people had pneumonia. I'm someone that had fortunately to date never had a pneumonia, and they've had these lung issues and everything of that nature. In addition, in 2013, there was evidence from 3 trials. They found over an 80% reduction in pneumonia incidence with the vitamin C. So 2017 trials showed that it stopped pneumonia. 2 other trials talked about it was a tremendous benefit once getting pneumonia, and another one decreased in 2013, 3 trials that said it decreased pneumonia over 80%. So without question, and we all know that vitamin C is immune enhancing. It's immune supporting. It's immune balancing. So here's a great supplement, and yes, you can get it in fruits. A lot of citrusy fruits have it. Most people think it's an orange. Strawberries are much higher.
Peppers too.
Peppers. Strawberries, peppers. So that would be great if you really saw the oranges kind of lower down. So some of these hidden gems when you look at. So fruits and vegetables high in vitamin C, take the supplement. Great choice. And this source on all this information is an article on April 16th, 2020. It's the British Medical Journal, Nutrition, Prevention, and Health, a very reputable journal. So again, feel free to keep doing those shout outs. Yes?
Dave D'Angelo, during this time, should you take 1 to 2 grams of vitamin C every hour up to bowel tolerance?
Great question, Dave D'Angelo. Good friend from Purity Coffee. Had a little bit, forgot to put the mug. Don't worry, I'm going to get to that. The question was 1 to 2 grams per day to get up to every hour. So what we're trying to do is we're trying to do not a mega dose, but we're trying to get to therapeutic threshold by doing 1 to 2 grams every hour. You could do that because we know if we consume too much vitamin C, it will change our bowel regularity. So I like that. So a lot of these vitamins, we're so deficient in them. It's very difficult for us to get up to the tolerance, and then we want to replenish them. So I like that, and you'll probably be able to do 1 gram every hour or two for the first day or two, and then you're going to get up to the point where you're going to see the regularity in your bowels change, and then you can go to 1 gram every 4 hours, etc. So people say, why not food? Let me eat a lot of food. I want you to eat good food. I want you to eat organic food. But remember this. This is a statement that I put in my book. Depleted cells cannot be repleted by food alone fast enough. So having said all that, if you want to get to threshold quicker, you need supplements because the supplement's pointed, it's absorbable, and it has the needed extra amount. Once you're there, you may need to supplement additionally, or you may be able to do it with food. And by the way, if people had been so negligent with food, they're probably going to continue to be negligent in the future. That's just what I found. I'm a big believer that people can change, a second chance, a third chance, etc. However, take that away with the supplements. Let's talk a little bit about vitamin D. Now, as you all know, had some really good studies that I shared multiple times on vitamin D. They're now calling vitamin D a powerful immunoregulator. So it regulates your immune system. That's a concept I want you to hold on to, immunoregulator. The receptors, it has receptors in a majority of the immune cells, macrophages, lymphocytes, P and T cells. There's receptors. Those receptors, those vitamin D receptors, ensure that when you get vitamin D, they are communicating with your immune system. This is really, the word immunoregulator is great. This is an not just regulator, it's a balancer, it's a supporter once again. It acts as a potential adjunct in protecting and treating those with viral respiratory infections. COVID-19, virus respiratory. What a great choice. They've shown with low vitamin D a higher risk of activation of viral respiratory infection. 25 trials. Vitamin D had a protective effect against acute respiratory infection. So we know it protects against respiratory infection. We also talked about it yesterday, decreasing mortality as we raise the level. Now, those levels were shown in grassroots.com to be above 30. Many people ask 40. I'm from 60 to 80. That's my belief in the numbers on a blood test. So I do believe in the blood test to raise that. There was a study that talked about it being considered a drug for COVID-19 as long as you went between 40 and 60. So vitamin D, without question, immunoregulator. So we've got immunonutrition, we've got immunoregulators. So far, we've hit the very basic ones. Vitamin C, with a substantial amount of literature behind it. Vitamin D. And let's get to the next one. This will probably not be a surprise to you. Zinc. It's the gatekeeper of the immune function. So immunonutrition, immunoregulator, the gatekeeper. So clearly, it's going to decide who comes in and out because it's a regulator of intracellular signaling pathways between the adaptive and the innate immune system. So it's the gatekeeper. It determines. Remember, we have an immune system. Let's not forget, for now, we always have the barriers, our skin, our gut, and all these are barriers. We have innate, which God gave you, and we have adaptive. So there's a gate between the two. You switch from one to the other. A lot of the bad stuff occurs with your adaptive acquired immune system. That's one of the reasons that children typically don't get as sick, but we'll get to that. We have some interesting new information on that. But it opens up the gate. And what it does is it balances that innate immune system and the acquired immune system. And also by being a gatekeeper, I like to call it a roof keeper. It doesn't allow the innate immune system to go too high. And when it does, it goes too high, you call that cytokine storm. So zinc, everybody knows. I mean, patients come in and go, can I get some zinc for a cold? Absolutely, a great choice. Like the zinc citrate or a full composite of zinc. In addition, The supplementation of zinc for more than 3 months was effective at preventing pneumonia in children less than 5. So again, over a duration of time, zinc is very potent. In addition, in the elderly, inadequate zinc status impairs immune function, reduces pathogenic resistance. So obviously, if talk to your grandmother, or in my instance, my mom's a little older, zinc is great. It also, by taking zinc, decreases the incidence and duration of pneumonia. So we have 3 very basic, and we're not limited to those, but that's the 3 that they talked about: vitamin C, vitamin D, and zinc. There is a cornucopia of other options. We've talked about PEA. We've talked about PEA because PEA was used as a drug previously, and is shown to have great outcomes because it attenuates the cytokine storm and the release of cytokines. What a great choice. In addition to PEA, pro-resolving mediators. I don't think we talk about that enough. Pro-resolving mediators. So fish oils are great. And I think fish oils are a great choice to consume at this time and at all times. Fish oils are supposed to convert to what we call resolvins, protectins, and maricins. Resolvins, short for resolution of inflammation. Protectins, protect against nerves, and maricins, protect against muscle. Yep.
Shout out from Cassie.
Hey, Cassie. Cassie, what's going on?
With the vitamin D, Dominic wants to know, do you think we have to take vitamin A for the cell receptor?
Actually, great question. So they asked about vitamin D. I'm not sure if everybody heard. Do we need vitamin A for the cell receptor? When we take vitamin D, it's D3, and it should be with K2 to K1 in a 6 to 10 to 1 ratio. Vitamin A is a great choice. Just wasn't talked about in this article. 2,500 to 10,000 milligrams, you're going to get a lot of immune boost from vitamin A. So I don't mind if you put it in. Now, coming back to the pro-resolving mediators, the resolvins allow for the resolution. The protectins allow to protect the nerve, and the maricins protect the muscle. So pro-resolving mediators allow for the resolution of inflammation. That's critical, especially with a cytokine storm. Some literature really spoke to the idea about that and decreasing the incidence of the cytokine storm. Remember, the virus attacks the lung, but the virus doesn't cause the lung to cave. It's the overexpression of the cytokines that actually damage the outer lining, the alveolar, and damages the lung. So it's a body's response. So remember, as long as we keep ourselves strong, our body will respond. It's our own protection, and it's also, once it's inside, its own protection. So I call it a double bulletproof vest. The first thing is, the first thing is that it protects the bullet from coming in, and the second one is if it comes in, it doesn't allow it to pierce as deadly, as fatally, or as, we'll just say, as sickly.
It's my question. Do men need to supplement with zinc more than women do, since men are usually deficient?
Yeah, great question. So the question was because she knows that we test zinc. We use a zinc tally test in the office, and most men are zinc deficient. So zinc tally, it's really easy. You're going to get 3 responses. You drink the zinc, you put it in your mouth. So men who are very zinc deficient, it tastes like water. Others like little taste, not too good. You give it to a woman, they spit it out. It tastes like gunmetal. So men are much more zinc deficient. And who knows, maybe that's an underlying reason that we'll get to at some point, why men are more susceptible than women. Men have a prostate which loves to soak up and sponge up zinc. So men need more zinc than women because anatomically there is a difference. So pro-resolving mediators are another great choice. You have your mushrooms, or your shiitake, your reiki, and things like that. I think that they work good, and always good amount of probiotics. Probiotics are going to be great because not only do they line and they speak to the nervous system, and they help communicate with overall health between the gut and the brain and everything of that nature, but probiotics also add a digestive component that's really overlooked. So the next thing I wanted to go over, and feel free, ask your questions, give me a shout out. I think I have a, make a comment, let's share it.
Siri wants to know which foods are high in zinc. I said red meats and oysters.
Right.
Legumes.
Terrific. Legumes, if you can eat them. Red meat, oysters are high in zinc. So you know what? We could Google that, or we could add a link, but that's true. And always go for the foods. Right now, everything is back in. All the companies that I work with all have virtually every product back in. They were able to restock everything after that initial rush out.
Pierre wants to know how much daily vitamin D3 for children and recommended daily dose of zinc for children and adults.
Okay, so D3, I hope they heard you. Recommended dose of D3 daily for adults. I'm a big proponent for children. So let's do adults and children since I started. So 5 to 10,000, probably 10,000 D3 for adults, down to 5,000 after a couple of weeks because you hit that threshold, like Dave D'Angelo talked about. If I can, speak to that, and vitamin C, make sure it's with K2, as I've said before. For children, I would do 1,000 milligrams. And zinc, adults, 40 to 60, children, about 10. So that would be the dosage that I would recommend. And since the questions are rolling in, let me get to nutrition for prehabilitation and nutrition for rehabilitation. You'll look in nutrition and they'll speak to a lot of the doctors. And a lot of the doctors in the ICU say, a lot of these really sick people have malnutrition. Well, food is the potentiator for information. Food is the potentiator for health. It's our gas. I would never, if you had a race car, put crappy gas in a race car. Why? Because it wouldn't work well. It's not going to be optimum. So why people choose poor food, they always have to look at it as a means to fuel your body. Jim Rome once said, take care of your body. It's the only place you have to live. Go around it. So it is what it is. So nutrition for prehabilitation. Before you get sick, what a concept. I think we're too reactive in America as proactive. One of the most proactive things, and we talk about this and we want people to implement this daily, is the prehabilitation, the concept of eating well now before you get sick, preventing yourself from getting sick, decreasing the level of or the veracity of the sickness. And then there's rehab, nutrition for rehab, getting sick, rebuilding your immune system, keeping it substantiating, keeping it balanced, even if it worked a little aberrantly, getting it to work well. Our bodies are finely tuned machines. You ever hear an athlete who goes, I'm a finely tuned machine? We want our immune system to be a finely tuned machine. And that is a critical system. Now remember that immune system speaks to many of the other systems in your body. So another takeaway is men. Why are men more vulnerable to COVID-19? Well, we talked about the idea over the last few weeks of estrogen and estradiol. Women have a higher amount of that, and that seems to be more, doesn't allow for as much viral replication. Men don't have it. Yesterday, we talked about the ACE2 receptor sites, and those are indicated and implicated in COVID-19, where the spike protein comes and grips in. We talked about, believe it or not, the testes having a high level of ACE2 receptors. So here, from the European Heart Journal, May 10th, just the other day, 2020, evidence from a large study of several thousand patients show that men have a higher concentration of ACE2 receptors in their blood more than women. So with those ACE2 receptors, obviously, they're more susceptible to the viral making an attachment and attacking them. Since ACE2 enables the coronavirus to infect healthy cells, this kind of explains why. So men are just more susceptible to it, and anatomically, and we have more ACE2 receptors. In addition, children face a risk from COVID-19. Remember when we said young people have nothing to worry about and everybody went out on the beach? They were wrong. It was early, and they turned out to be wrong. You know, hindsight is 20/20, as we say. Children, teens, and young adults are at a greater risk for severe complications from COVID-19. Most of the children admitted to the pediatric intensive care visits had underlying conditions. So when they get sick, they really get sick. So the problem is if you have somebody that's a teenager or a child and has one of those underlying conditions, a comorbidity, you really want to be cautious with them, and you don't want them to be too aggressive as they reintroduce themselves into society till we get a little bit better grip on what's going on and we have a better idea. Now,
would vaping cause them, the teenagers?
The vaping has been considered, since teenagers seem to be vaping at a very high level, the vaping has shown, smoking, vaping. We don't call that a comorbidity, but look at Italy. They were smoking a lot. They have a high level of smokers. They had a higher mortality rate. Can't be anything that damages the lungs can't be good for clinical outcome of COVID-19. So we're going to talk what the policy makers need to know. This was here. Here's your article. It was in the Lancet, April 27th. So this was an editorial, and I thought it was excellent. I thought this guy was, to an extent, spot on. So I'm going to reiterate what he says. I'm not giving you my opinion on all that he says. And in addition, many of these topics we're going to talk about on Thursday with KBMO Diagnostics Chief Science Officer, Dr. Brent Darville. He's going to come on and answer some specific questions about this and about testing for the spike protein, and all that's changed because now we're back into the antibody testing. Now companies are buying antibody tests because if the employees have the antibody test, they're going to allow them to come back to work. How high? How much? All those questions, 1 o'clock on Thursday. So let's talk about the linchpin strategy. This is what they said. This is what they felt. Increased testing. We are behind everybody, well, not everybody, but behind many countries in the world in the percentage of tests that we take for our population. We want to contact trace. So for instance, one of my patients just got an IgM positive and IgG positive. So in theory, as you know, IgM is early, IgG is later. Probably classically, she's 14 to 21 days into the coronavirus. So I explained to her she was happy in that she felt okay. She had like a little cough. She wouldn't have thought that she even had coronavirus. I told her to get the swab test. She went this morning right away, 7 o'clock, to go get the swab test. I told her, well, now you have to tell everybody you live with and everybody you're in contact with, certainly after you get the swab, that they now have to know that they've been exposed. And it was a little hard. Yeah, but I'm not that sick. I feel that good. You're not that sick, but it's contagious. Other people can be. And what's amazing is the asymptomatic showings that she has made her believe that she wasn't sick, and almost like people couldn't get it, so other people can get it. So we really have to explain to them what's going on. And obviously you see people in the news now, people working for the government administration are self-quarantining. Return to work permits, that's what they said. Checking your immune status. So I guess a return to work would be like if you've got IgG, you can go back in the workplace. They're looking for new therapeutics. Well, I don't know if they mean drugs or they're talking about all the alternative therapeutics that we have. And of course, they mention the word vaccine, which I'm not touching in any way, shape, or form. In addition, antibody testing, which can lead us to herd immunity. Well, sure, the herd immunity is at 60% now. So we need 60% of Americans to have IgG, or 60% of the population or wherever to have IgG. I haven't seen a number for that yet. I haven't seen anybody say when that will happen. You want to measure antibodies. Measurable antibodies is not the same as protective. So you may have some, but it may not be high enough to be protective. And that's a great question that I'm going to ask Dr. Darville. So about 10% can be measurable. Well, better yet, a certain amount may be measurable, but they may not be protective. When you take a vaccine, it's supposed to produce antibodies. Well, the interesting thing about many vaccines is now they've studied people and found out years later they don't have the antibodies anymore. So it may be measurable, but it may not be protective. 10 to 20%, they claim, symptomatically infected have little or no detectable antibodies. So the theory was that viral load was low, your immune system was strong. You may have had it, but you may have not produced antibodies to it because you may have not needed any. How long is immunity to COVID-19 likely to last? They spoke about that. Right now, they're guessing the immunity is a year. They're not sure if we get a third or fourth wave 3 to 4 years later. I think that by that time we'll have different options, but they said about a year. This was in the Lancet, April 27, 2020. Here's that article if you guys want to take a look at it. It's just an interesting read. I wanted to share some of that information where people think we're going. Obviously, it's more of a medical model. It has its place and it has its opinions without question. So please, once again, every day, 1 o'clock between 1 and 1:30. We usually come on a couple of minutes after 1. Yesterday, I apologize for being late. Little technical problem. You never know with Facebook what they're going to do and how they're going to treat you. Feel free to give a shout out, ask a question, comment, share. The comments will definitely help. Give me a thumbs up. You watch the whole thing. Share it with your friends. We're a little short on the shares. The information, I'm getting it from my team. I'm reading every day, trying to come prepared. Do you have any last second questions? Excellent. So hopefully everybody enjoyed today. We're going to try and get back on tomorrow a few minutes after 1 o'clock. If I can. If not, I'm certainly here on Thursday, once again with Dr. Brent Dorval. I talk all about the antibodies and things that we talked about and the spike proteins and where are we all going with this and how it correlates. Just as a quick aside, the antibody test and the swab test now, he gave me a little insight, 95% accurate, 95% correlated. So though, people are giving a number on the test and a number on a swab. We're talking how it syncs. So we're going to go over all that. So without any further ado, again, it's always been my pleasure. Hope to hear from you soon. Dr. Rob, always yours in health.